Today I am going to tell you about the articulated foot. So before knowing about the articulated foot, you should know that the foot is directed just 90 degrees to the leg, and that is why the foot is giving the maximum stability when you are standing. It is having two arches, longitudinal arches and transverse arches. In the longitudinal, medial longitudinal arch, lateral longitudinal arch. Medial longitudinal arch is little higher than the lateral. Lateral is almost at the ground level. So all these things will be discussed in the arch of the foot. The tarsal bones are arranged into 3 rows. First row, talus, calcaneum. Second row, only one bone is the navicular. And third row, we are getting 3 cuneiform, 1, 2, 3, and cuboid. So these are the all 7 tarsal bones. They are placed in 3 rows. Now we'll see separately about the talus. So talus is a bone which is connecting the foot and the leg. So if you see the lower end of the tibiofibula, we are getting this tibiofibular mortise. Here, medial malleolus, lateral malleolus, facet for the head of the talus, facet for the medial surface of the talus, the triangular facet for the lateral side of the talus. So the talus is having, see it like this way, head, neck and the body. So head is articulated with the navicular bone. So the anterior part of the head is articulated with the navicular bone, and the whole bone, if you see, it is directed little downward, forward and medially. And we will see the direction of this calcaneum just opposite. It is directed forward, upward and laterally. That will be again discussed when I will discuss the calcaneum. So if you see the talus is directed forward, little downward and medially. So anteriorly, the head of the talus is articulating with the navicular bone. And the plantars, this is the plantar surface, this is the dorsal. So plantar aspect of the head, still it is having 2 facets where it is attached with the sustentaculum tali. You can see this. So this is calcaneum. This projected part of the calcaneum is called sustentaculum tali, where it is a shelf for the talus, head of the talus. So 2 facets are there for the head, where this head of the talus, plantar aspect of the head of the talus is getting supported by the sustentaculum tali. And one ligament will be there where this head is floating. So head is supported anteriorly by this navicular bone and below by this sustentaculum tali, and in between there is a ligament that is called spring ligament, plantar calcaneo-navicular. In anatomy, that is the most important thing. In the name only the answer there. It's plantar calcaneo-navicular ligament or spring ligament, just like my finger is plantar calcaneo-navicular ligament, which is also called spring ligament. So that is giving support to the unsupported part of this head. So actually, if we see this navicular bone, this sustentaculum tali and this spring ligament, they all are making a socket like thing for the head of the talus. It's looking like a ball and socket joint. Okay. Now I'm going to describe the neck of the talus. So neck of the talus, just behind this head. So in the lower part, you're getting a groove. You can see there is a groove. And corresponding with this groove, there is a groove there in the anterior 1/3 part of this calcaneum. So when the talus is coming on this calcaneum, these 2 grooves are making the sinus tarsal, where we are getting another ligament that is called interossei talocalcaneal ligament. So everywhere, name itself is giving the answer. Interossei talocalcaneal ligament. We are getting in the, that is that tunnel, that sinus tarsal. Now coming to the body. So if you see the body, so this part is the body. Body is having superior surface, this is lateral surface, this is medial surface, and one is the posterior surface. Okay, so superior surface, it is articulating with the superior surface is articulating with the tibiofibular mortis, where the superior surface is articulating with the inferior surface of this tibia. Medial surface is articulating with the lateral surface of this medial malleolus, and lateral surface is articulating with the triangular facet of the medial surface of the lower end of the fibula. Okay, in that way they are forming a supratalar joint or ankle joint. Okay, so now coming to the posterior surface. Posterior surface, we will get a groove, and on the both side of the groove the tubercles are there. This is a posterior tubercle and this is the medial side, so medial tubercle. Through this, the tendon of the flexor hallucis longus is coming. So we know already, we have studied the posterior compartment. So where the flexor hallucis is coming from the middle part of the posterior compartment. We know the superficial compartment, intermediate compartment, and deep compartment. In the middle compartment, from the tibia medial to the vertical line, and from the fibula lateral to the medial crest. Here we are getting the flexor hallucis longus. Here we are getting the flexor digitorum longus. So this flexor hallucis longus is coming through this groove in between the medial tubercle and the posterior tubercle, and then taking a turn. And here, this is the sustentaculum tali. So from here, it is taking a turn and coming below this sustentaculum tali and going to the first toe. So that is the groove for flexor hallucis longus. The groove is forming also in the posterior surface in between the posterior and the medial tubercle. So now after this posterior surface, we should know about the inferior surface. So in the inferior surface, if we see inferior surface, it is articulating with the middle 1/3 of the superior surface of the calcaneum. So that is forming the subtalar joint. So this is little oblique, because we have seen the talus is directed forward medially and downward, whereas calcaneum is directed forward laterally and upward. Okay, so that's why this joint is little oblique. That is the subtalar joint. So we got here subtalar joint, we got here sinus tarsi, and the talocalcaneo-navicular joint. Okay. So you can see here talus is articulating with the four bones, navicular, calcaneum, tibia, fibula, forming three separate joints. Here it is forming the talocalcaneo-navicular joint or the pretalar joint. Above it is articulating with the tibiofibular mortis, forming the supratalar joint or ankle joint, and below it is forming the subtalar joint with the calcaneum. So this is all about the talus. One thing is very, very important. Talus has no muscular attachment. This is the only bone in the articulated foot which is not having a single muscle attachment but lots of ligament attachment. Now coming to the calcaneum. So calcaneum is such a bone which is little more extended behind than talus, and our body weight is mainly transmitted through this calcaneum. We will see that. So calcaneum is having lateral surface, superior surface, inferior surface, posterior surface, and medial surface, anterior surface. So anteriorly, first we can see, so this is the first row talus, calcaneum. This is navicular, and the third row is the 3 cuneiform with cuboid. So this is the cuboid, name itself is telling cuboid shaped. Anteriorly, the articulating surface is saddle shaped, articulating with the corresponding surface of cuboid, forming the calcaneo-cuboid joint, making saddle joint. So if you see here, this talo-calcaneo-navicular joint and the calcaneo-cuboidal joint, so they are on the same line. So that is called the mid-tarsal joint or transverse tarsal joint. Here, bifurcate ligament is there in between these two joints. So now coming to the lateral surface. Lateral surface, we are getting one tubercle anteriorly, one tubercle posteriorly. This anterior tubercle, it is called the peroneal trochlear. Above and below of this peroneal trochlear, we are getting the two tendons. One is peroneus brevis and below peroneus longus, which is going to the other side below the foot. We'll discuss afterwards. So regarding this posterior tubercle, if we see the ankle joint, so then we will see one ligament from the lateral malleolus, the calcaneo-fibular ligament. So that is attached to the posterior tubercle, and this anterior tubercle is for the peroneal trochlear, which is separating these two tendons. Now coming to the posterior surface. In the posterior surface, in the middle third area, we are getting the attachment of tendoachilles or Achilles tendon, where the soleus gastrocnemius together is coming, and medially the attachment of the plantaris is there. So soleus, gastrocnemius and plantaris, they are attaching here, where medially plantaris is placed and tendoachilles is attached to the middle third of the posterior surface. In between this, so this is the small superior surface where no muscle, no tendon is attached, where we are getting the bursa and the fibrofatty tissue anterior to the tendoachilles. Okay. And in superior surface, we are also getting this articulating surface for subtalar joint, and this is in the middle 1/3. So in this anterior 1/3, we are getting the attachment of this bifurcate ligament in between these transverse tarsal joints, and also attachment of the stem of the inferior extensor retinaculum. We know that inferior extensor retinaculum, from the stem, it is like a Y-shaped, is going up and dividing into upper band and lower band. That is, stem is attached to the anterior 1/3 of this calcaneum. Another muscle is the extensor digitorum brevis. So that is also attached at this anterior 1/3 of the talus. So now coming to the medial surface. In the medial surface, we have seen this is little concave and is going up and extended as the sustentaculum tali. Lower part of the sustentaculum tali, where the groove for the flexor hallucis longus. And in this medial area, we are getting the attachment of deltoid ligament, spring ligament. Spring ligament already I have described is like this, plantar calcaneo navicular ligament, where the unsupported part of the head is getting support, and also the some fibers of the tibialis posterior. This will be discussed when we will discuss detail the muscle attachment of the foot. And now coming to the inferior surface. In the inferior surface, we are getting 3 tubercles. One is lateral tubercle, medial tubercle, and anterior tubercle. The space between these 3 tubercles, the origin of the long plantar ligament. This anterior to this anterior tubercle is the short plantar ligament, and medial tubercle is little lower than this lateral tubercle, where when you are standing, you are supporting actually on the medial tubercle. Okay. So this is all about the calcaneum. So now I am going to describe about the navicular. Navicular means little ship. So this is the only bone in the middle row. We have described in the proximal row the talus and calcaneum. In the middle row, only the navicular bone, and the front row is a 3 cuneiform and cuboid. So this is navicular bone, which is articulating with the head of the talus posteriorly. Anterior surface, it is articulating with the 3 cuneiform bones. Out of them, maximum is attached with this medial cuneiform, and it is also attached laterally with the cuboid. In that way, it is articulating with the 3 cuneiform, cuboid, and talus. Now, if we see the medial surface, dorsal surface, plantar surface, this medial surface mainly the attachment of the tibialis posterior, whereas the dorsal surface will get the intertarsal ligaments, dorsal ligament, and inferiorly we have already seen the spring ligament, the plantar calcaneo-navicular ligament, very important ligament. That's why repeatedly I'm telling. So the attachment in the inferior surface, you're getting the spring ligament. Okay, so this is all about the navicular. Now I will tell you about the cuboid bone, which is having anterior surface, small lateral surface, dorsal surface, medial surface, posterior surface. Posteriorly, it is forming the calcaneo-cuboid saddle joint with the anterior articular surface of the calcaneum. Medially, it is articulating with the lateral cuneiform and navicular, and anteriorly, it is articulating with the 4th and 5th metatarsal. So now, it is having a groove inferiorly. If we see here, just now I've talked about the lateral surface of the calcaneum, where we are getting the peroneal trochlea. Just above the peroneal trochlea, it is the groove for the tendon of the peroneus brevis, and below peroneal trochlea we are getting the groove for the peroneus longus, which is after coming here, it is taking a turn below the groove. We are getting a groove in the plantar surface, this groove, and it is going to the opposite side, medial side of the medial cuneiform. This is the cuneiform, medial cuneiform, and base of the first metatarsal, there where the attachment of this peroneus longus is coming like this way, which is helping in the eversion. Okay. Now we'll come to the 3 cuneiforms. So if you see, they are all wedge-shaped bone actually, and they are articulating posteriorly with navicular, anteriorly with the base of the 3 metatarsal, number 1, number 2, and number 3, and laterally it is articulating with the cuboid. Very interesting thing here, if you see the size of the 3 cuneiform, medial, lateral, and intermediate is comparatively little shorter. So that's why there is a mortise forming in between this 3 cuneiform, where this base of the 2nd metatarsal is going little behind in compared to the other metatarsals. That's why the 2nd metatarsal is coming into the mortise formed by this cuneiform, becoming the most stable metatarsal out of all this. That is the reason why axial line in the foot is going to the 2nd metatarsal. And now if we see the muscle attachment, the medial part, inferomedial part of this medial cuneiform and the base of the 1st metatarsal, where we are getting the attachment of tibialis anterior, it's coming like this way, and inferiorly, inferolaterally, we can say we are getting the attachment of the peroneus longus. So peroneus longus is attached to inferolaterally, whereas inferomedially we are getting the attachment of tibialis anterior. So this is all about the cuneiforms. Now if you see the metatarsals, they are counted from medial to laterally, number 1, number 2, number 3, number 4, number 5, whereas in the hand, as the antivial position of the hand, because of the rotation of the hand, the number 1 has gone laterally, so counting will be from lateral to medial, but in the foot, counting will be from medial to lateral. But if we compare with the metacarpals, we will see here the base is much more thicker than the head. In every metatarsal, base is thicker than the head, whereas in the metacarpals, head is bigger than the base. The first metatarsal is much more stronger, but longest is the second. We can come. Now the muscle attachment of the metatarsal, if we see the base of this first metatarsal, we are getting the attachment of tibialis anterior. And now coming to this base of the fifth metatarsal, where three structures are getting attached. This is styloid process, this is dorsal surface, and here is the inferior surface. So in the, or you can see the plantar surface. So in the styloid process, the attachment of peroneus brevis. Then just in the dorsal surface, we are getting the attachment of peroneus tertius. This peroneus brevis is coming like this way, just above the peroneal trochlea, whereas the peroneus longus, it is going to the other side. So peroneus brevis, here is the peroneus tertius, and the plantar surface, we are getting the flexor digiti minimi, which is attached to the plantar surface. Now regarding the dorsal interossei, 4 dorsal interossei, they are all bipinnate. First dorsal interossei is inserted at the base of the proximal phalanx of the second toe, the medial side, whereas all other dorsal interossei are attached to the lateral side of the base of the proximal phalanx. That's why they are the abductor of this middle 3 toe. And if you see the plantar interossei, they are arising, they are all unipinnate, they are arising from the medial surface of this 5th, 4th and 3rd metatarsal, and they are attached to the medial surface of the base of the proximal phalanx. So they will be the adductors of these 3 metatarsal. Now I will describe a little bit about the phalanges. So here we know there are total 14 phalanges, same like our hand, 3 of lateral 4 toes and 2 for the great toe. Okay, so most important structures are here, the proximal phalanx, where medially we are getting the abductor hallucis, whereas laterally we are getting the adductor hallucis, and distal phalanx, dorsal surface, we are getting the attachment of extensor hallucis longus, whereas the plantar surface will get the flexor hallucis longus. In the same way, in all other phalanges, the distal phalanx, there will get the attachment of the extensor digitorum longus with lumbricalis, and in the plantar surface will get the attachment of flexor digitorum longus.